waking up in the morning and knowing that nothing bad is going to happen to you necessarily. It's a very basic thing.
I love my grands, the children, they make me happy. And I love to see them happy too. Since I'm retired now, and I help out my daughters with my grands, because I think with a grandmother, a good grandma, you have the love for them, you watch out for them. And that keeps me going. The abuse started when they took the children from my daughter and put them in foster care. And then my daughter had like a resentment towards me. She'd be very like violent, you know, always want to fight. And she always was threatening to kill me. And this last time I was going downtown with my granddaughter and my grandson to do a petition for custody. And I don't know how she found out I was going that morning, but as we were leaving my apartment to go on the elevator, she was coming out. And she tried to pull my granddaughter and I was holding her and she started fighting me. I felt real bad. Because it was my daughter and she didn't have to go that route. You don't expect that from your family members. I would never in 100 years, if somebody would have told me this lifetime that I would be facing this, I would say no. I cried at night. And sometimes I wish I could just go away.
Elder mistreatment means to me elder abuse or physical abuse and complete loss of dignity for an older person.
So, available data from Adult Protective Services. Every state has an agency for adult protection, and there are mandatory reporting laws for elder abuse. So the agencies are showing an increasing trend in the reporting of elder abuse. So this could reflect not only that there's an increase in abuse, but hopefully that there's more awareness about it and people are starting to report. But unfortunately, an overwhelming number of cases of abuse and neglect and exploitation still go undetected and untreated every year. One study estimated that only 1 in 14 cases of elder abuse ever comes to the attention of authorities. There are also health consequences, as you may imagine, of this abuse. One study found that older adults who experienced abuse, even modest levels of abuse, had a 300% higher risk of death when compared to those who had not been abused. Another research has shown that victims of elder abuse have had significantly higher levels of psychological distress, lower perceived self-efficacy than older adults who have not been victimized. In addition, older adults who are victims of violence have more health care problems than other older adults, including increased bone or joint problems, digestive problems, depression, anxiety, chronic pain, high blood pressure, and heart problems. And you can learn more about this Elder Justice Act from the National Council on Aging. I think I'm just going to escape out of it. Let's see. Yeah, that brings us back to the slide. Yeah. So on this. Oh, okay. Okay, thank you. So these are some links, and you certainly can have a copy of this after today. So if you're interested in getting more information about different states, different adult protective service agencies, and so forth, there's a lot of variation there. Switching to talking again about the Aging Network. So the Older Americans Act was really landmark legislation. It's actually the 50th anniversary of the passage of the Older Americans Act this year, along with Medicare, Medicaid. So 1965 was a very productive year in terms of policies and support for health and for older adults in particular. And these programs and services are largely administered and delivered through what are called area agencies on aging. They serve all adults who are 60 years and older, and they provide services either directly or they subcontract to community-based organizations. So it really it does vary somewhat. A more rural area agency on aging, or AAA as they may be called, not to be confused with the Automobile Association of America, might be more likely to actually provide those services directly. But a big county like Los Angeles, there's actually 2 area agencies on aging in Los Angeles. One is the City Department of Aging, and the other one is the county.
County's huge.
Yeah, it's just so huge. So they subcontract to hundreds of different organizations that provide these services. So now, just to give you an idea of the dollar amount that's attached to the Older Americans Act programs and services, in 2014, the funding for Older American Act programs was $1.88 billion. And the funding has actually been relatively flat over the last 10 years or so. It really hasn't increased. And that $1.8 billion is used to serve approximately 11 million people, 60 years of age and older. So that's a lot of money, $1.88 billion, but if you talk about Medicare dollars, just as a point of comparison, in 2013, Medicare outlays in 2013 were $492 billion. So this is a very important component of the social and sort of supplemental services that help maintain older adult health and well-being. But in terms of federal budget, it's actually a much smaller piece of the pie than Medicare outlay, not surprisingly. So these programs fund critical services that are designed to help keep older adults healthy and independent. These include services like meals. You've heard of Meals on Wheels. There are also congregate meal programs that occur in community settings, which, in addition to a nutritious meal, we hope, also provides some opportunities for social engagement, particularly important for older adults who are living alone and isolated. The programs under Older Americans Act also include job training, so there are opportunities. They have an RSVP, I forget what the acronym stands for, but it's something to do with volunteer programs, so senior volunteer program, ways to stay engaged, and those programs even offer a small stipend. Usually it helps cover some travel costs and maybe some meals, but it's something. And again, the value of not just looking at older adults as people that have needs, but also recognizing that older adults have a lifetime of experience and wisdom they can bring back to communities. So there are all kinds of very interesting, innovative programs, intergenerational programs where older adults can work with kids in schools, or kids in schools can work with older adults and help them learn computers and so forth.
And
so,
reading programs too, I think,
yes.
in schools.
Yeah, absolutely. So there's, yeah, so these are all social engagement. There's also caregiver support programs offered through the Older American Act. So as of 2000, it's the first time since 1965 that they expanded legally their service population to include family caregivers. So people who are caring for someone who's 60 and older, but also caregivers caring for someone 18 and younger, recognizing there are a lot of grandparents who are caring for their grandchildren. And these programs, they're a very small amount of money given the size of the caregiver population, but they do provide some educational resources, some social support. They have support groups, some respite so that the caregiver can get a break. Someone else gives some funding to help care for the loved one while the caregiver takes a well-deserved and needed break in many cases. And other programs under Older American Act are some of the health promotion programs we talked about earlier, the chronic disease self-management programs and falls prevention. There are also benefit enrollment programs. And I know I'm throwing a lot of information out at you, but just kind of giving you the big kitchen sink about older adult services in the community. So supportive services program include also things that our case management. This is really getting more to people with actual health and functional needs. So there's homemaker services. In California, the in-home supportive services program is the largest program for personal care, not medical care. But these are helping with housekeeping, helping with cooking, helping with transportation to doctor's appointments and so forth. And then there's in-home respite, I mentioned already, and then Alzheimer's daycare is another very important program that's funded through the Older Americans Act. Mindful of the time. Okay. Another program that's maybe less known but very important is called a HICAP. That's a Health Insurance Counseling Advocacy Program. In some states it's called the State Health Insurance Program, SHIP. So you can think of HICAP or SHIP, but they're essentially the same thing. And these are services where they have very highly trained volunteers who learn, and bless them, they learn the intricacies of Medicare.
Wow.
And they learn how to counsel people about what benefits they are entitled to. And since that's always changing, if you can imagine, it takes a lot of in-service training and continual re-education for the volunteers to do that. They make a very big commitment to learn the essentials of Medicare and then be in a position to provide that counseling. But something for you to know, because as practitioners, you know, you're likely going to have patients who come to you and say, you know, I don't know, you know, whether this covers that or what covers what. And HICAP is a really good resource for that. The one in Los Angeles is called the Center for Healthcare Rights. Again, back to the whole thing of things are called different things, which just adds to the confusion, unfortunately. But this is a service that's available for all Medicare beneficiaries. And counseling, and then the other piece is if there are problems with getting reimbursement or, you know, having coverage for things that are supposed to be covered, they will help guide you or your patients for that purpose. So the Center for Healthcare Rights is the one for Los Angeles County and the city. But you can go to the State Health Insurance Program to find any state where what HICAPs are available and where they're available. The big public benefits for older adults, I've been talking about in general terms, Medicare, of course, Medicaid, or Medi-Cal as we call it here in California. And I'm not going to go into the details there for those, but other public benefits just to touch on, there are special benefits under Medicare for prescriptions for low-income patients, a low-income subsidy program. That's under Medicare Part D. There are state pharmaceutical assistance programs that also can help provide subsidies for patients that can't afford or don't have coverage for their prescriptions. I've already mentioned nutrition. You might be surprised to know that there's even a senior farmers market nutrition program. And these are coupons that similar to SNAP, which is formerly known as food stamps. Very important program and very underutilized by older adults. It's, you know, it was originally designed and sort of much like community health centers, really thinking about younger families and children and nutrition needs and health needs at that level. But actually there are many seniors who could really benefit from having SNAP. And now it's an electronic card where they can use it at participating grocery stores to get nutritious foods. But this is like a variation on that. They even have coupons now for farmers markets. So since farmers markets have been springing up everywhere, you know, this is a way to get fresh fruits, vegetables, herbs, honey from local farmers markets using this nutrition program. Other things just to quick mention are energy and you know, California, I guess this is probably most important in a place like the high desert where it can get very hot, and if somebody's air conditioning, he or she can't pay their air conditioning bill or their electric bill, that could become a real problem. Refrigeration for medications, or if somebody's on a ventilator on a machine that requires electricity, then
Well, sometimes it's considered an emergency depending on the level.
Yeah.
You know, when I was doing my postdoc in Arkansas, in Little Rock,
yeah.
if the air conditioning went out for elders, it was considered an emergency situation.
Okay. Well, as it should be. I mean, you know, there are some terrible tragedies. I'm thinking back several years in France, and yeah.
I see it's income dependent, so basically majority of elders are making more than about $2,000 a month, so a lot of will be not eligible for this program.
Right, that's right. These are for very low income.
Low income,
and
no income at all.
And like,
Well,
like
24,000, isn't it 2,000?
It says monthly, if you live by yourself, it's $1,276.
yeah.
Then you'll be eligible in California.
Yeah.
Yeah,
month.
so that's like people who qualify for supplemental security income, SSI.
Probably, yeah.
And that's pretty much they're on a fixed income of about $800, $900 a month.
Yeah,
That's it.
that's
So
what-
it would be the same folks that qualify for that,
It is,
that would
yeah.
qualify for this. But
Yeah.
you're absolutely right, it's
Very
very,
low
very low or no income folks who qualify. So that raises a huge policy issue, because there are people who clearly fall in between, above that line,
Right.
who still are gonna have the same risk and the
Right.
same potential terrible outcomes if they lose electricity, if
Right.
they can't pay for heating or,
They call it like poor rich or something. They have a house.
Working poor.
working poor. Yeah.
And then they have a house.
Or they
No,
may
that's
have a
right.
house, they may own a house
But they
but not be
cannot.
able to live.
That's
Yeah,
right.
Yeah, yeah,
Right,
that's
that's
right.
right.
Another quick thing I wanna
But
mention.
they have equity in the house, which is something you
Yeah.
were referring to earlier.
Right,
People
right.
at about not high number.
That's right, they may own the home, but doesn't mean that they can still afford to live in it, keep the utilities going, and continue to pay for all of the needs they have, taxes and long-term services and supports. And I just saw a report about the latest in nursing home in California. You know, it's over 100,000 a year now is the
Yeah.
median.
Median.
Median
Median for nursing home.
for nursing home care. That's the middle, so there's another 50% above that, 50% below that. It's just shocking. And then even home care is about 45,000 a year for people who need in-home care. And again, you know, that's in the middle range, so it's really,
It's very expensive.
it's a huge issue of how this is gonna be sustained over time. And it can't be sustained on the backs of individuals, it's just untenable for the average person. Important resource is benefits eligibility. So we talk about all these programs, and I was gonna quickly pass around this really crazy chart. It's on two sides.
Oh, I
So
love this plan.
if you look at the top, on the front page, the page that's facing you, this is the California Aging Network. I talked briefly about, you know, all these different programs. And so just to give you an idea, you know, here are all these programs and different agencies that, you know, legal services, adult day services, senior employment, all this is great, right? Wonderful. We have so many programs for older adults. And then if you flip it around and imagine being the consumer, first of all, being a professional looking at this, I'm kind of getting a little dizzy. And then turn it around, and this is a consumer's view of long-term care services. Wow, there's so much out there, but how do I access it, and what am I eligible for? You know, what do I do with this, right? And they're, you know, unfortunately, very fragmented in the funding, delivery, administration, and so forth. There's a lot of effort and continuing effort to try to integrate a lot of these programs and services, and to create a universal assessment, so somebody who's eligible, you know, can qualify for across the board. But I'm afraid that's still a little bit far down the road. But the point of this is not to freak any of us out, but just to be aware that it's a very complicated set of programs that are out there, but they are out there, and there are programs to help people find the benefits they're entitled to. So that's I think this is these are two websites and resources where people who are on a computer and internet savvy can actually go on and sort of see what benefits they might qualify for, but there are also centers where you can go and somebody can help talk you through that as well. So there's physical locations you can go, and your patients can go and get counseled, because they may find out, oh, I do qualify for that low-income energy assistance program, or I do qualify for X, Y, or Z. And these are all things that can help you support their health and well-being in their homes and communities. So similarly, we have long-term services and supports in California, and this is just a graph of the home and community-based services. So it excludes skilled nursing facilities. But you can see, again, a range of programs. I'm not going to go through all the acronyms, but just in the interest of time, these are really the set of programs from in-home supportive services, which I mentioned before, which provides home care, personal care. That's a Medicaid or Medi-Cal program, so it is for low-income folks. They have to meet a certain income threshold or be below it, and then also they're at risk for nursing home placement. So the idea of in-home supportive services, IHSS, is these are supplemental supports that can help people avoid nursing home placement. The CBAS, I'll tell you very briefly. So community-based adult services provides medical and social therapeutic services. It's a program for adults 18 and older who have one or more chronic or post-acute conditions, or two or more activities of daily living limitations, and insufficient family support. And this program provides not only support for the consumer or patient, but for the family members. So an example would be you know, the working daughter who has to go to her job but can stop and drop off her father at the adult day service. It used to be called adult daycare. Now it's called CPAS. And then go and do her job and then come back, and it gives the older adults the opportunity for engagement with others, their activities, and there's also health care on site. And a number of them have a special section if people have dementia, so they might have a sort of a step-up program where they get more one-on-one attention while they're at the adult day program. I don't want to not mention the informal assistance bubble, because that's really where the bulk of long-term services and supports happen. It's really mostly family and friends who provide for the ins and outs of daily care. And pets is also up there because we found in one study that we did that pets actually were a huge source of social support. And it gives people a reason often to get up and to do something, a purpose in life. I want to get up, I have to walk my dog or feed my dog, and providing some company. Very, very important.
By the same token, the death of a pet is a huge loss.
Oh
for a
my
lot of
goodness.
people, sometimes underestimated.
Yeah, no, that's true. They're just part of the family. They really are for many. So I know that we've got another person who's going to be joining. I'm going to wrap it up here. I think there's that crazy graph that I gave you.
I love that graph.
And these are the other sources for finding long-term services and supports. You know, these are sort of beginning phone numbers and where patients, you can direct patients or their family members to help locate what's available for them in their area. Through the Affordable Care Act, a number of provisions are really moving towards shifting more and more away from institutional care to home and community-based care, where I started this today, most people want to be in their own homes and communities. And that's really where they can get the most appropriate care culturally, socially, because these are communities and families that they've grown up with. So that's where most people want to be. So a number of these provisions are really promoting that. The other, which is probably more even closer to what you do, is the promotion of interdisciplinary care teams, really working across, physicians, primary care providers, nurse practitioners, physician assistants, across the board, social workers, really trying to get across the full continuum of care, health and social care. So there are a number of provisions that are, supporting those efforts. And a lot of them are demonstration programs that are being tested, and they have to be found to be effective before they will go full scale. This is a list of some of the programs. So we're hopeful. Yeah. I didn't want to be all Debbie Downer.
No, but I think that's true. I think that,
yeah.
Because they're geriatric care by its very nature has to be essentially interdisciplinary.
Right. But we need policies that support what's required to do this care, to do it well, to keep people living, as healthily and successfully as they can.
Although it's talked about a lot, it's still not financially supported so much. Right.
And
that's part of it.
Right, and a number of these provisions are not even necessarily talking about older adults, which is interesting. And I'm doing a project right now with community health centers. Again, not traditionally, their service population has not traditionally been older adults. And so we're talking about ways to really frame it where people understand that it's, if it doesn't work to come at it from the point of view of, do you know how to work with older adults, then, well, what about people who have multiple chronic conditions? Don't you see a lot of people who have multiple chronic conditions, and are there ways that care can be provided better? Is there, or people with disabilities, and people with disabilities are all ages, right? So I think it's a way, it's a matter of finding common ground and maybe language that people are more responsive to.
It gets out of the stereotyping, like it gets out of some of the issues.
Right, it's not just about those old people over there,
right.
It's really about people in general and what happens, what we talk about in gerontology a lot is a life course perspective. We're all aging, we're aging from conception onwards, right? And so there are different ways, and I had the privilege of doing a policy fellowship in DC. I worked in a senator's office during healthcare reform in 2008, 2009, and I was the second oldest next to the senator in the office. And because staff aides in Congress tend to be very
20s,
young,
they're-
in their
yeah.
20s mostly.
Yeah.
And it was my thing was to go and gerontologize all the staff there. And so really, I mean, here we are talking about health, we're talking about healthcare reform, Medicare, but nobody was talking about older adults. So it's kind of a funny conundrum, but I think I succeeded a little bit. You know, one of the person that I worked with most directly subsequently took a position with the Special Select Committee on Aging. And so I know it's not because of me, but I wanted to say a little bit of gerontology rubbed off on her.
Because I think I told you this, because I used to teach this course for undergrads at UCLA, which was it was a seminar course that actually a lot of people wanted to take. So my colleague and I, she taught Who Wants to Live to Be 100, and I taught Elders on YouTube. And so looking at media presentation, how it affected health, etc. But I always started the class with, I'd come in, and these are all like 20-year-olds, you know, literally, because they're just out of high school, most of them, and then maybe second, third year bachelor's. So I'd say, I wish you all successful aging, and they'd all kind of look at me like I was nuts. And they kind of look like this, and I'd stand at the front, and I'd say, so what's the alternative?
Yeah.
And you know, it took till year 3 until somebody finally put up their hand and said, death. I said, exactly, you are either aging or you are not here.
Yeah.
What's your preference? You know, and they kind of like, oh, it was just very interesting.
I wanted to add something for the nurse practitioner aspect. A lot of those services and everything require maybe a physical assessment, TB testing, especially if they're going into assisted living or certain programs. The SSI, sometimes you don't usually do the initial assessment, but if they were denied, you may be asked to do a secondary assessment so that they can appeal that. I mean, that is huge. I mean, across the board, every clinic gets people coming in with those papers saying, can you please, and it's a functional exam, and it's very lengthy, and a lot of places won't do them. And but you're gonna run into them. I forget which setting I was in this last week, and I saw that familiar paperwork sitting over in the corner. It was a community clinic in Compton, that's what it was like. And so that in-home support services, a lot of times you will be asked to fill out forms, and depending on your agency, whether that's their policy to do it, or how do they handle that? Just be aware. And sometimes they'll have the nurse practitioner actually do the work and fill out the form, and the doctor will just, you sign it and then they'll co-sign it, depending on the rules and regulations. So a lot of those different things, well, it just depends on, you know, and the rules change all the time. You can do, for example, you can do workman's comp, but now you have to take a special course, and then you can do workman's comp as an NP. And maybe, you know, sometimes with in-home support services program, from year to year, they'll change the regs to, I think you will see more and more nurse practitioners will be allowed to do it just because there won't be enough providers. You know, those rules and regulations will change as the need just expands and expands. So you may be seeing paperwork that applies to a lot of those programs she just mentioned that you might have to looking at and making maybe a functional assessment with your patient.
Because we were just seeing patients today at Kindred, and Kindred is an acute care rehab. So patients come, they're maybe a little borderline, and their average ages, a lot of them are 90, but so they may be a little borderline, but they might be at home, and then they fall, or they have a heart attack.